mid-level. Lovely. Hello everyone, welcome to today's video. Today we have a patient with frozen shoulder for the left side, यानी adhesive capsulitis भी बोला जाता है. So we will be asking our patient today what kind of pain he is having, how long has he been suffering from this frozen shoulder, and then we will start the treatment. तो आपका अभी कितना दिन से ये मतलब हुआ है?
ये मेरा 7 से 8 महीने से ज़्यादा हो रखा है.
7 से 8 महीने से ज़्यादा. तो 0 बीइंग नो पेन, 10 एकदम दांत उखड़ने टाइप का पेन है, तो कितना अभी नंबर देंगे?
10 में से 10.
10 में से 10 ही देंगे. आप थोड़ा सा दर्शकों को दिखाइए कितना उठा सकते हैं हाथ. ओके, सेंटर और साइड में कहीं जाता है, कितना जाता है? नीचे से साइड से कीजिए थोड़ा सा. ओके, तो आप देख ही रहे हैं, यू आर ऑल वाचिंग दैट ही इज हार्डली एबल टू मूव हिज शोल्डर अप. सो ऑब्वियसली इट इज अ केस ऑफ फ्रोजन शोल्डर. वी विल टेक अ लुक एट द एक्सरे एंड देन वी विल डिसाइड एज टू द डायग्नोसिस, फाइनल डायग्नोसिस. ठीक है, थैंक यू. एंड देन व्हाट काइंड ऑफ ट्रीटमेंट वी विल बी डूइंग. व्यूअर्स, you are able to look at the right shoulder and the left shoulder with the arm by the side of the body. As you can normally notice that the acromioclavicular joint, there is a little bit of a gap, which is normal. But if you notice the left side, the acromioclavicular joint is closed. It does not have a gap. Also, you have to notice that the humerus, which is the arm bone, has a gap between the acromion and the head of the humerus, which gives a space or tunnel for the rotator cuff muscles to pass through. But on the contrary, if the left arm, you are seeing it's elevated, as well as there is hardly any space for the rotator cuff. That's what the reason why there is pain along the lateral side of the arm when the patient is lifting the arm laterally. तो यहाँ पे बहुत दर्द होता है इसलिए फ्रोजन शोल्डर में, क्योंकि ये हाथ उठा हुआ रहता है ऊपर के तरफ. ऑलराइट, वी विल स्टार्ट विथ लिटिल बिट ऑफ रिलीज for the scapulothoracic muscles and obviously the shoulder girdle muscles like upper fibers of trapezius, scalene and lats, which is actually coming from the bottom up. So we will try to release a little bit. This also helps the patient to gain confidence in the treatment rather than, putting too much pressure on the shoulder joint. And we are kind of nearly done. So we will start our chiropractic adjustments at a higher level of cervical spine. A little. Done. Done. Mid-level. Nice. और एक बार. That was good. हाथ ऐसे रखिए. Perfect. Relax. Relax. And on the right side, हल्का से. Done. Done. Lovely. We'll go to till about mid thoracic spine, क्योंकि scapula यहाँ तक आता है. So we have to hit these spinous processes and the transverse processes of the upper back and mid back to eliminate any kind of stress and tension on the scapulothoracic joint, which is nothing but a floating joint or pseudo joint, यानी false joint. लंबा सांस लेके छोड़िए और एक बार. लास्ट. Lovely. All right. I hope you guys have heard that too. लंबा सांस लेके छोड़िए. So this is more on the rib angle. Lovely. I got it, but I doubt you will be able to hear this part. ये बहुत हल्का से होता है. And last, which is at an angle. Done. Going over the scapulothoracic joint lightly. Done. That will be a little bit painful. Going over SC joint, sternoclavicular joint. Done. Going over the glenohumeral joint at a different plane or shear force. Done. And a little bit of traction. Done. Relax. ठीक है, पहले याद रखिए. If you can also rewind on the video and see, his angle was about 45 odd degrees. Now we will see. Ask him actively how much he can lift. थोड़ा सा उठाइए जितना हो सके आपसे. Okay, so close to about 90 degrees. बाहर से, नीचे से, साइड से. that is also around 75-80 degrees. So that's a good improvement in about 3 or 4 minutes that we have treated through chiropractic mechanism. हल्का से छोड़िए यहाँ पे. So now we will be doing some osteopathic techniques with hammer and chisel that you guys all know. I'm going over the scapulothoracic joint on the superior part of the supraspinatus fossa, जहाँ से supraspinatus muscle निकलता है. अभी we will be going over the coracoid process. Pec minor insertion point है वो. This will help release the pec minor muscle. ये बेसिकली राइट शोल्डर है. सो हम लोग ट्रीट किए ये साइड पे ताकि ये जो हेड है वो पीछे की तरफ आ जाए. We also treated the AC joint, acromioclavicular joint, on the SC joint यहाँ पे, in fact on the left side, ताकि ये movement अच्छा करे. ये जब movement अच्छा करता है the clavicle, then the scapula also moves or rotates up and down and also internally and externally, और फिर tilting भी होता है उसका. And this will help the humerus of the arm to move in a better function or biomechanically better, have a more dynamic stability of that joint. Glenohumeral joint, and then lastly we'll do a little bit on the AC joint. ये थोड़ा सा दर्द थोड़ा सा आता है. That's it. I heard it. Very, very soft, mild clicking on the labrum. Done. 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 Got it. That was a over boundary, 6 runs. Done. All right. You can see right now how much he is able to lift, right? ऊपर नीचे, ऊपर नीचे. एरकम. हाँ, ऐसे perfect. करते रहिए. Right. Saw it? That's amazing. Come on. Come on. पूरा ऊपर की तरफ. Very, very good. I am extremely happy, as you can all note that he is already crossing 90 degrees, right? So my hand is actually inside. I'm not sure you will be able to see. Let's change the camera angle and let's focus on this one. करते रहिए. All right. So 5, 4, 3, 2, 1. Relax. Okay. Now, moment of truth. Let's see कितना उठा पा रहे हैं. याद रखिए, rewind करके देख लीजिएगा शुरू में कितना था. So you have to rewind and watch where his original range of motion was when he was actively moving it when he came for the treatment. So after the treatment, let's see how much he is able to lift. चलिए आगे लेके जितना हो सके without pain free range तक उठाइए. Bam! Right? See that? That's just amazing, isn't it? Again, I know that there are still restrictions. It's not magic. It's all based on scientific evidence and research. So, abhi bhi mera kaam hai. So, he has to come for maybe a day or couple days depending on how his body and muscles are reacting to the treatment. But as you can see, he has hardly any pain. Abhi dard kitna hai?
कुछ नहीं है.
यहाँ अभी
यहाँ स्लाइड कोई 1%.
1. So from 10 on 10, so let's say 2%. I'll be more conservative now. He has only 2% pain remaining from let's say 100 on 100. अच्छा बाहर से थोड़ा सा लेके आइए जितना हो सके. All right. ना कान की तरफ, मतलब दोनों हाथ अगर हो सके तो. हाँ, there you go. ताली भी मार आ रहा है एकदम. Fantastic. Now that's wonderful. But I can see there is a little bit of biomechanical deficiency in the scapulothoracic joint जो ऊपर खींच रहा है. So that will take 1 or 2 more days to fix it and set it in the correct order and position. So आपको कैसे लग रहा है?
बहुत अच्छा.
So thank you so much for watching. Please give a thumbs up and do a like, subscribe and share with your family members. If you do like our channel, certainly go ahead, come, and you can give us a call, and we will be happy to take care of your problems. So until next time, alvida. Bye.
Thank you, doctor.
Thank you.